Hey, Dr. Rob Kiltz, how you doing? Another awesome and amazing day, and Facebook Live. And don't forget, if you like this and you want to see us do more of this, keep hitting the likes, sharing a little bit where you're coming from, and we really appreciate the questions that you've been sending us, and Will's helping on the technical stuff, and I'm working to get better at this. And on Sunday this week, I'm looking to do about a 4 p.m. Live chat again. And Carrie, really thanks very much, Carrie K. How long would you suggest taking all that medications for improving egg quality to be effective before proceeding with IVF? She's 42. Should I do the prime for 100 days and be on the meds for 2-3 months to improve quality, or proceed after a month of meds due to age? Well, always the 3 months plus is going to improve everything. But because of your age, starting a stem and stacking these stems to do one in bank, another in bank, each one seems to improve the function of the ovaries. And in general, we're seeing better eggs and more eggs each time. The truth is that 3 months may not matter very much, and we're getting plenty of 42-year young women who are improving on the keto plan, the DHEA, the human growth hormone, and the low-dose naltrexone. And don't forget to add massage, acupuncture, and yoga. Shauna Marie, about to start first IVF after 4 failed IUIs and a laparoscopy surgery. Any tips or suggestions as we enter this first big step? Feeling very anxious and excited, and it's my pleasure, by the way. And we're all stressed in life, and it's natural to be stressed in this process. So don't stress about being stressed. Just accept that it's just natural. If you're feeling it, it usually means you're going in the right direction. Acupuncture, yoga, massage, fertile friends. This whole CMY Fertility chat group and Facebook is about a community to help support each and every one of us. So touch base there. And our nurses are great, and I've got my cell and text, and I pass it on if I can't. But if it feels uncomfortable, I usually say it means you're going in the right direction. And no one likes to get the experience to get better at this, because we really want to have very little experience and be successful quickly. So I hope I helped in that. Mostly it's about meditation, prayer, acupuncture, massage, support group, and a fertile friend is really, really important. Michelle wondering when would you recommend donor eggs? Is there an age cutoff for trying with your own? Well, we don't have an age cutoff for trying with your own. Quite often we find that there's a need to try. I call it a do. So by doing something, we never know the outcomes until you do it. And in the mid-40s, we've seen pregnancies. In lower ages, not. Even approaching 50 years young, we've seen the need to do the IVF before you're willing to say, okay, let's go to donor eggs. So the beauty of the donor egg process is that your age doesn't matter. So you can do the donor eggs as you age more and still have the same success as when you're younger. Medina, can you see a change in egg quality after a laparoscopy? If you were to have retrieval after lap surgery, I would say in general, we do see some improvement. If we're removing endometriosis or scar tissue, we're clearing up the inflammation. I think we do see a little bit of an improvement in many cases. But I'm not giving you a scientific, we've seen a study with that, but and I know that many people talk about laparoscopy maybe not improving outcomes, but we've seen it improve outcomes, and I think it does improve egg quality and in some cases quantity. Ellen Mary, is there a benefit to using Femora over just trying your luck unassisted over 40? Well, quite often we're combining some form of ovulation, and Femora or letrozole is a pretty easy medication. It's well tolerated, not a lot of side effects. And so I think overall there's some positive benefits to a little bit of letrozole, 2.5 to 5 milligrams, a trigger shot versus just natural. Plus, letrozole seems to enhance the uterine implantation receptors. And so we do find some benefits by using the letrozole at many ages. And we're using it more and more for frozen embryo transfers, so I really think that there's some benefits. Amara B, are there any tests that can be done prior to my initial consultation? Well, there's a lot of tests that can be done. Sperm count, your own OBGYN doctor may be able to do the hysterosalpingogram, but we do it in the office. And quite often we do it, it's less painful. And we get a live look at that. So you might want to wait a little bit. But there's some blood work looking at genetics, chromosomes, CBC, looking at metabolic function, liver functions, and karyotype, chromosomes, and also there's a genetic screening test that may be very helpful. And we have a list that we'd be glad to send out to you. I think it's on our website. So I think that can help move things along a little bit faster. Looking at an AMH, we may have, and also hemoglobin A1C, and again, the metabolic parameters I think can be really helpful. Let's see. Deborah, in a previous video, I mentioned drinking less water. What did you mean by drinking less water and feasting like a lion at night in your video other than, let's see, should we not drink as much water? And as far as feasting, do we eat more meat or a hand-sized portion? My husband took feasting as much beef as you want. All right, so we've been programmed to drink 5 to 8 glasses of water and more. There's really no scientific evidence with that, and we actually may be diluting out some of the enzymes in our digestive tract, and it actually is just simply even diluting the serum levels, and it's really just going to be peed out of us pretty quickly. When you're thirsty, it's time to drink. Most of us, unless we're having serious problems with vomiting or diarrhea or haven't eaten or drinking for days, we're not likely to be dehydrated. And it's interesting about feeding. We're driven to eat as much as we can until we're full, and dinner time is a good time to do that because once you're full, you want to go to bed, rest and digest. Blood flow to the intestines is the best when you're resting. It allows the most efficient digestion to happen. And because when you're active, blood flow is stolen away from the digestive tract, and it makes it very indigestion prone. So again, as much as you want, it tends, if you're eating a higher fat content, bacon, eggs, butter, beef, it suppresses appetite faster. If you're eating a lot of carbohydrates, fruits, fiber, vegetables, cereal, breads, you're going to tend to stimulate insulin and stimulate hunger, and you're going to tend to eat much more. Maria Emmerich has a really great book on ketogenic adaptation. Her cookbooks are wonderful, and we've been working with Maria for some time now, and she's a great resource. And I say like a lion because lions eat 1 meal a day or less, and we're really meant to eat much fewer than we've been doing. And I apologize, I'm still recouping from this upper respiratory virus, and my voice has been a little challenged, so I apologize for it, but it's really getting much better, and I think I'm on the healing leg of this viral journey. All right, Ara, we have male factor issues, low count of 10 million and low morphology. So typically 20 million, 15 to 20 million or greater, and greater than a 4% morphology that's normal is considered normal. Going through IVF, they retrieved 21 mature eggs, 13 which fertilized with ICSI. They were doing well on day 3, but on day 5 they were still in the compacted stage. Day 6 they called us and said they all stopped developing. That's our challenge with this. It's very devastating, absolutely. What could have caused them not to have blasted, and what can we do to avoid the same fate next time if we ever get the courage to try again? Well, courage, strength, persistence really is helpful in this process. And giving up, we all want to give up from time to time. In general, if they don't blast, we believe it's really the sign of a deeper male factor. And this is where, for guys, metabolic treatment, Ovasitol, the keto diet is really important. The Conception XR, and there's a motility support. I really recommend it. And there might even be reason to look for varicoceles. So a testicular scrotal ultrasound, I think, could be very helpful. And again, the diet, acupuncture, massage, stay out of hot tubs, get rid of alcohol altogether. Those are things that'll help tremendously. But I've also seen some cases where we took them on day 3 and froze them or transferred them, and we got great success. So everything to blast doesn't make any sense, although I would have done the same based on the number of fertilized eggs that you had. So the issue is, let's improve the sperm, let's change the environment a little bit, and sometimes the culture environment, that cycle may not have been the very best. Oh, one other, human growth hormone for guys and low-dose naltrexone. So I think that the 3 months of both of those and acupuncture can really be helpful. So, and if you're liking all of this, please continue to share and tell us what we can all do to improve this. Sina, let's see. Can overstimulation cause poor egg quality? 30 years old, never smoked, don't drink, healthy weight, healthy diet. Just did egg retrieval due to husband's varicocele, but was surprised to hear that the egg quality was poor. 27 eggs retrieved, 60 mature, 5 fertilized, and 1 made it to freeze on day 5. I had a son 3 years ago and got pregnant naturally after 2 months of trying. Been trying for number 2 for 2 years with 1 miscarriage. Embryologist said the eggs didn't look good, and that's probably why such few fertilized. 350 gonal, 150 menopure, an AMH of 3.87. I wonder if pushing me to too high a number of eggs could have compromised. Absolutely. This is where the human growth hormone may help. It may be that there's a little bit of metabolic syndrome, and using the Ovasitol, the Ovasitol and the LDN can really be helpful. The ketogenic diet, and lower the dosing. It might even be a 300 of menopure only, and trigger early with a little bit of HCG and a little bit of Lupron. And it may be more reasonable not to try to go to day 5. Again, some people just don't make good blasts, but they make good day 3s. But in this case, my sense is going to up to 3 months of a prime preparation to reduce the inflammation. And one of the things I've learned, again, healthy diet, it may be that there's a lot of gut inflammation, which means intrapelvic inflammation, and going on the ketogenic diet could be really, really helpful. How are we doing? Everyone doing okay out there? Thanks again, Will. We may add some fresh questions, but again, I've got a great list here, and I think we're doing really well. Alicia, can you still do the full immune protocol with the frozen embryo transfer? If so, are there any supplements that can be taken along with the protocol to enhance implantation? So, low-dose naltrexone, the keto diet, Ovasitol, Ovavite, and Theramegas. Now remember, the Ovavite is the preconception, which has the methylfolate, the vitamin D, and the CoQ10. And then the Ovasitol is inositol to help all of us with metabolic syndrome because of a high carbohydrate intake into the gut. And then the immune protocol, where we've been looking at things like Plaquenil or Prograf, the intralipids weekly or every 2 weeks, the IVIG every 2 to 4 weeks. I'm kind of giving the full-on list. It may not be right for everyone. I tend to be a little bit more empiric because idiopathic infertility in general is related to inflammation, and all our bodies are dealing with inflammation. The leukocyte immunotransfusion is something we send our patients to Mike Vero in Toronto at Markham Fertility, where they'll take the male white blood cells and inject it under the skin of the female. There seems to be an immune reaction like doing allergy shots. So I think there's really a little bit of, there's some good benefit to that. Although you have to go outside America, you have to go to either outside the US to either Nogales, Mexico, or Toronto are the closest to our borders. And so I think that the immune protocol really enhances things. Prednisone, Lovenox, aspirin is kind of all part of the mainstay, along with the Neupogen, Prograf, and the IVIG and the Interlipid. So I hope that's been helpful. Kayla H, stage 4 endometriosis. AMH level is 4.3. That's good. Can you tell the egg quality from this test? Well, the AMH tends to signify a better ovarian reserve, but doesn't always tell us about the quality. Endometriosis can have an adverse effect on the eggs. I've been suggesting letrozole 2.5 milligrams for 1, 2, or 3 months to lower the estrogen environment in lieu of Lupron, which puts you in a menopausal state, and most women do not like it. And then I think the low-dose naltrexone can be really helpful in that. And of course, the ketogenic diet, a home run. Viola, can my daughter be in the room with us when they do the transfer? Absolutely. The transfer room is a little bit more open. The retrieval rooms we're really making much more clean and sterile with no visitors. Can you transfer 3 embryos on 32, 1 or 2, rarely 3 at 32, but we'll look at the embryos, we'll look at individual cases before we ever make that decision. We always want to make this count, by the way, and we're with you. To do a full cycle in Syracuse, how long will I have to be there? Well, it's about 10 days of monitoring and stimulation. 2 days later is the retrieval. And then 3 to 6 days later is the embryo transfer. So you're looking at about 3 weeks. Many of our clients are staying at the Maplewood, but there are lots of great hotels in our area. And Maplewood is great. Pick you up at the airport, take you to and from our office, and also the mall and any pharmacies you need to go to. So we really want to make this as easy as possible. We're really passionate and committed to affordability and upping the quality, improving access globally. And I'm always very gracious and grateful to everyone for sharing the story. We're working on, just keep sharing it, ways of improving and helping others. Donate your embryos, donate extra medications. And we're looking for younger women to begin thinking about donating their eggs, really donating them, so we can help more and more women and couples out in this, and even same-sex couples and individual men and women. Kathy Z, thank you, and it's our pleasure. Always gracious to do this, and always wish we can get every one of these going. I had 2 20-millimeter follicles, and my retrieval was on cycle day 10, and both eggs were immature. Does triggering time 35 instead of 36 affect egg maturity? Lupron and Novarel can affect egg maturity. You know, it's very interesting about this, and the fewer eggs, the more odds you're going to have of getting immature or no eggs, the fewer follicles. We've been more and more suggesting earlier trigger when you have only a few at 16 to 17. Maybe that 10,000 units of HCG or the Novarel Pregnil Profaci, but it might even be worth some human growth hormone. And remember, improving egg quality may also take laparoscopy, looking for endometriosis in all this. And the low-dose naltrexone also may help with that. And when I say low-dose naltrexone, look it up. LDN really has been helpful. We've learned this from some studies done over the last 20 years in Ireland. So I think that's some really good basis to using low-dose naltrexone. Share. How soon after I deliver can we transfer our last M-baby? I recommend 3 months. It may take 6 months depending on any complications, but I don't think you need to wait 9 to 12 months. 3 to 6 months, you should be able to do it. We generally recommend if you're breastfeeding, you should wait on that also. Ellen, is there a benefit to using Femara over just trying? Again, we got that. I hope I didn't go back up again. And so I think the Femara is helpful over just a natural. Male factor infertility. Anti-sperm antibodies count has greatly dropped after 5 years post-vasectomy reversal. 5 years ago, anything be done about that? Well, it's the environment in the intra-abdominal space that affects the pelvis, the scrotum, the testes, the prostate, the seminal vesicles, the ovaries, the uterus. All of this is affected by what goes into the intra-abdominal space. Go keto. Lion King plan. Low-dose naltrexone. Check for varicocele. Treat that. It may even be a course of 30 days of antibiotics. There's a lot of subclinical infections for men and women, and we've kind of gotten away from that, but I think it's really something important between bacteria and yeast. We have to be a little bit more diligent. A longer treatment plan can be real helpful. And look at Conception XR through Theralogics. I think it's really, really helpful also. Antioxidants, acupuncture, massage, yoga. And guys, get rid of alcohol, tobacco, chewing tobacco, all really, really, really hard on the process, on the body. And don't give up. Don't give up. Jennifer, after one round of failed IUI, would you recommend another IUI or go straight to IVF? IVF in general is twice as successful as IUI, which in general is twice as successful than natural intercourse if you have a history of infertility. And so that said, it's really always, we're consultants, we have a menu, but IVF is going to offer the best chance in the shortest amount of time to improve your chance of conception. So it's really your decision if it's 1, 2, 3, or 4, or no IUIs before you move on and do that IVF. Interesting enough, many couples have coverage for intercourse and IUI cycles, do an intercourse IUI cycle, and if you're making extra eggs, we can add on a retrieval, reduce the number of eggs, either freeze eggs or freeze embryos, bank them, and then if you don't conceive from the intercourse IUI cycle, then go on to frozen embryo transfer. All right, Natalie, this is a good question. Which has a better chance of success, a day 5 or 6, a 5-day or a day 6 blastocyst embryo, and assuming both are the same grade? And really, embryos move between day 5 blasting and day 6, we think really have about the same chance of success. If they blast on day 7 and on day 8, then the success rate's going to be even less. But we think that same quality, day 5 and 6, essentially the same. A day 7, less. But remember, if it becomes a blast, or if it's a cleavage stage embryo that's either fresh or frozen, the only way it's going to have a chance to become a baby if it gets in your uterus. So that's still, it's got to make it there. And I see so many people that don't get blastocysts, but we transfer on day 3, and bingo, that's the one that works. So there isn't one way to do this for anyone. You have to be really, really broad in the options. Let's see here. All right. Julie, we have one embryo to transfer and want to know the success rates with only transferring 1. We did a fresh transfer and transferred 2. Only 1 stuck resulted in our 1-year-old daughter. Well, if you had a child from the same cohort of embryos, even 1 or 2, the odds are still excellent that 1 embryo has a great chance of success. And so you're looking between 30 and 50% delivery rate per transfer of embryo. And so it's real important to give that embryo a chance. And whether you do a natural cycle or letrozole in a trigger cycle or medicated with estrogen. And Rosalind H., what would you recommend for stage 4 endometriosis? It seems like the other recommendations are mainly for PCOS. Also, would you recommend aspiration of an endometrioma prior to beginning IVF? So, idiopathic unknown cause, metabolic syndrome, polycystic ovarian syndrome, diminished ovarian function, pelvic endometriosis. Now, I think that they're all related to chronic intra-abdominal, vascular, and systemic inflammation. And so treat them similarly, although PCOS, we even will look for endo and do something called ovarian drilling or ovarian acupuncture, helpful. The laparoscopy for endometriosis is helpful to excise and drain endometriomas, although there's some evidence that if you do too much of an excision, you may create diminished ovarian environment and function. But by removing scar tissue and endometriosis, either vaporization of superficial, laser vaporization, or excision of deeper, then you're going to tend to improve the environment. But I think that all of these encompass the food changes with ketogenic. I think the letrozole can be very helpful 30, 60, 90 days at the low dose. The low dose naltrexone, the ovasitol, ovavite, and theramegas are all sort of a global approach. In some cases, we'll do a depo-lupron. I don't tend to recommend the birth control pill, but you could do a progestin only, which tends to reduce the stimulation of the estrogen on the endometrial tissue environment that's growing in the peritoneal cavity. I believe the endometriosis that we see on visualization is kind of the tip of the iceberg. Much of that is the inflammatory reaction that we're seeing happen, but there's a lot of atypical that we see that we may not call endometriosis, but it really is treated in much the same way. Acupuncture, massage, support, change in food. The reason the Lupron helps because it suppresses estrogen, but there's a lot of side effects, and more we're not recommending it. And the other problem is insurance companies aren't covering it. It's costly. But there have been some studies in some women that do a 3-month course of Depo-Lupron and then go for a stimulation that improves the environment and the egg quality. Ashley, and I do like hot tubs. What part of the cycle is okay to use the hot tub, saunas, steam rooms, and what part is not okay? Well, if you're heating up the internal body temperature significantly, even 1 or 2 degrees, it may adversely affect the sperm and the eggs in the environment. So in general, we're recommending don't go in. Put your legs and your feet in, soak and relax a little bit. If it's body temperature, but it's interesting, the body's trying to cool itself down, and if you're putting yourself even in body temperature water, it may have a harder time. And again, it may be 1 to 3 months for eggs, definitely 3 months for sperm. So I'm holding back on my recommendations. A little bit of steam, but you know, these warm showers obviously we're taking just for a few minutes. It may be a cold soak may actually be the better part of that. Reduces cortisol, epinephrines, and it really may be the thing to do as much as anything else. But my bet is it takes a few minutes for the internal core temperatures to change. I haven't really seen any temperature measurements on that, but it might be interesting to look around for that. Ashley, I have my consult in January. My local doctor has given me the option to do an IUI with injectable meds. Is there a benefit to doing that? such as more knowledge of how to respond. Is there a negative that could be detrimental to IVF? I always say doing something is always better than not doing something. And so our hopes are that you do this and you get pregnant and deliver a baby. And so it would be good, see how you respond. And if you over-respond, you just call up and say, hey, Dr. Kiltz, I have too many eggs. Can you retrieve our eggs? And we'll be glad to work with you on doing that. Kimberly, any testing you recommend after 2 failed transfers? Had a lap kissed about a year ago, maybe do another. I'd say it may be time to do another. And I often don't recommend doing the immune testing, but it may be worthwhile. Make sure you have chromosome testing. Do the immune testing. Look at both partners' chromosomes and karyotype. A repeat hysteroscopy, laparoscopy. Make sure you're doing the hysteroscopy and the scratch procedure. Think about adding embryo glue, doing the intrauterine HCG wash, making sure you're adding a full implantation enhancement, and looking towards either LIT, IVIG, Humira, or adding Plaquenil. And remember, the Lion King plan is the key. It's bacon, eggs, butter, beef, bam, baby. 1 meal a day, every 12 to 24 hours is the very best. It removes the excess carbohydrates, which cause something called glycation, which damages every cell of our body. So look up glycation, and it can be really, really, really helpful. All right, Sarah, can you explain OHSS and is it possible to get after transfer? So ovarian hyperstimulation syndrome, much more prevalent in our past. So since we used Lupron as the trigger, it's much rarer. HCG trigger, when you have a high estrogen or lots of eggs, and tend to be estrogens greater than 3,000 to 4,000, more than 15 to 20 eggs in general, but you can have only a few eggs and a lower estrogen, you can still get ovarian hyperstimulation syndrome, which is enlarged ovaries, typically after the HCG trigger or after the retrieval or IUI or intercourse. Fluid can leak out in the ovaries, build up the abdominal cavity, cause a buildup in pressure, difficulty breathing, and you need something called a paracentesis or drainage of the fluid from your abdomen. And we really do very few of these now, thankfully. By triggering with Lupron, it reduces the risk. Adding some Dostinex just with the trigger and post-retrieval. If you do a transfer and you get pregnant, you're more likely to get hyperstimulation if you already are hyperstimulated and may need the drainage. Quite often we're recommending a freeze-all cycle and not doing a transfer and or canceling if we think you have too many. All right. And usually the ovarian hyperstimulation is self-limited, goes away with rest, not too much fluids, loose clothing, no shopping at the mall, and it really, really just rest, and it typically goes away on its own. Occasionally someone has to be hospitalized, but again, that's pretty rare. Jen, we did IVF in our own state previously due to a 7.7 AMH and a story when one healthy son. AMH does not tell any of us that you will or won't be successful. We see plenty of women with lower AMHs have a baby and higher AMHs not have a baby. So that's really a great story, and thanks, Jen, for sharing. We want to be encouraging to everyone out there that you just got to keep at it and don't give up. AMH is 0.43. Egg quality is now average appropriate for my age of 38. At what AMH would donor embryos, eggs be recommended, and is there a cutoff? I don't have a cutoff because no one number gives us the answer of you think that you have. And so it may be reasonable for you to do a stimulation with that AMH or higher, and others might choose to still do an IVF cycle. Little different protocols, the HGH prime, either a mini or standard dose, and don't forget the DHEA and the keto diet. All those things will really, really help. I do have a phone consult scheduled this month. Okay. And we look forward to working with you. My nurse practitioners are wonderful, and we're all working together to help make this happen, Jen. So thank you. And Heather Sue, is it possible to extract viable sperm from someone who is chemically sterile due to medication? So if you've had cancer therapy with either radiation or chemotherapy that sterilizes and kills all the sperm generating cells, then it's not likely. But in some cases where people are on testosterone, it suppresses their function, and adding HCG, Clomid can help in a lot. And it might even be reasonable to first do an aspiration, see if you get any, because I've seen cases where we thought, no way, and voila, then we get sperm. So always be willing to look. There's no real good test that says no way. You got to do an open biopsy and search it out. So do we have any more live questions here, Will?
Yeah.
And let me see if I can even go here into our live.
Here,
but
I'll give you one.
Will's going to help us. Again, if we're given what you like and always want to come back, help us like and share. Tell us where you're from. And remember, we all need support out there. And the semi-fertile group has really been helpful. And again, I'm really learning. Whether you're new to the process or you've been doing this for a while, persistence matters. And you have to look towards natural. Remember, our job is to first share ideas that are going to help you conceive naturally. And we're not just an IVF center, although we do a lot of IVF. We see a lot of individuals and couples where they need immune therapy, simple change in what they're eating, thinking, how they're working with their body. Slow it down. Go for a walk, Tai Chi, yoga, really helpful in the process. A lot of faith, positive attitudes really help us be more persistent in the process.
I think Jasmine has a good question.
We do a lot of natural cycles for either IUI or IVF, and the same goes for donor eggs. And so be open to that. Let's see, Jasmine, thanks much for your question. Is there no more faith in fresh transfers? I feel like everyone is going towards frozen, and I'm second guessing my wish for a fresh transfer. Well, there's a lot of opinions as what is the very best. If you don't make a frozen embryo, you never get a transfer in many cases, and many centers are really just honing for the very best opportunity of the very fewest embryos to give the highest success rates, but we're missing out on some earlier stage embryos, and even in some cases, some fresh transfers. I have clients, couples, individuals who have done frozens and didn't succeed and went back and got pregnant, delivered baby on fresh, and the same vice versa. If you have plenty of embryos, it may be reasonable still to do a fresh transfer. In general, if your progesterone level on the day of trigger is above 1.5, or you have excessive number of eggs and embryos, more than 10, it may be reasonable to plan a frozen embryo transfer. We see so many people traveling the globe to come to see my fertility in Syracuse and Albany. If they have enough embryos, we're working to help them to get the best transfer and the best options possible. So we're all second guessing the process. And when it doesn't work, we're always wondering, gee, should I have done it differently? But I still think fresh are good, frozen are good, and preparing the body and the mind and doing what's right for the individual. Fewer embryos, I say look towards a frozen. More embryos, plan a fresh, but you're going to still likely get some frozens there. All right, Joanne. I'm taking metformin and letrozole 5 milligrams. I make good follicles and do a trigger shot, but still, it doesn't appear like you're ovulating. Now, it may be worth switching up a little bit. looking towards laparoscopy and ovarian drilling or ovarian acupuncture could help. And it might be worth a dual trigger in these cases. And I always question, the only way you know if someone ovulates is if they get pregnant. Maybe worth some extra progesterone supplement. But if the trigger in the IUI or intercourse isn't working, think towards IVF, because it's possible there's a dysfunction in the ovarian receptors that prevent that release of the egg. In addition, it may be worth a little bit of low-dose gonadotropins, Gonalef, Menopur, Follistim to try to kind of improve that area a little bit. Stacy, I have a lot of scarring from surgery, from removing endo and cysts. Do I still have a good chance with IVF? So if you remove or find a lot of scar tissue at the time of laparoscopy and you're unable to repair it, there's still a lot of benefit to IVF, and it's not necessary to remove all of that. Sometimes we'll look inside and say, you know what, this is too much, we got to walk away. And it's moved right on to IVF. There may be a reason to resect hydrosalpinx if you're finding in that case. Melissa, all right, if you produce a ton of follicles, how is it that you only get such few mature eggs in egg? This is our $1 million mystery. There's a cohort of eggs coming up and we give the stimulation and they grow. Some will respond better than others. If we can get all of them to come up in the cohort at the same size at the same time, which isn't so simple, then we're more likely to get more eggs and more mature eggs. But there's a huge bell curve in this. Some people will get a lot more mature, some will get a lot more immature, but there's that 60 to 70% maturity on average. And then if you're really pushing for the maturity, change it up. I always recommend human growth hormone, the dual trigger with HCG and a double Lupron can be real helpful. And Allison and Mahia, thank you very much. Really a pleasure. Deborah, recommend for the perfect coffee in the morning. All right, so I'm just I use Verissimo and Starbucks myself. I love the pods. I do a shot, a double shot of regular coffee and a double shot of espresso. That's my very best black. A little butter from time to time, full cream if you like. And there's lots of great coffees. We're just using Recess Coffee. We use Kubal, Finger Lakes. So there's a lot of great coffees out there. Find the one that tastes the best, is richest. A few coffee cups a day, I think, is okay. There's a lot of evidence that caffeine kind of helps as an antioxidant. I think can be really helpful. KW, we're all working together in this magic, by the way. And what I've learned about the science, boy, it's all over the place. And the more I've stepped back and listened to all of you guys out there to share with me a lot of the non-traditional stuff and even some newer traditional stuff that maybe we weren't quite as open to, I'm learning. So thank you very much. All working together. We're all co-creators, I'll call us. We're not, as a reproductive endocrinologist, I went to school a long time to learn this, but I'm realizing that the real schooling is in the practice and experience as we're all sharing and learning together. And let's see, how are we doing time-wise? All right, a few more questions here, and I'm really appreciative. And again, this Sunday, 4 p.m. Eastern Time, wanted to try to get a day where people maybe aren't exhausted, some time off. I'm going to work to do some Saturday, Sunday events over the next few months and in 2018. Continue sharing, continue learning, and tell us what you're finding out there. I got one great question earlier today about PRP, that's platelet-rich plasma. And I'm working on getting New York State to allow us to use it for intrauterine infusions, which may help with implantation, 1 month, 2 months, or 3 months of treatment, and whether or not it may help increase the intra-ovarian environment with the stem cell environment that may help the ovary create some better quality eggs. That may be something very interesting that we're working on. And Joel, excited we're there today, and we're looking forward to the retrieval on Wednesday. And it really is a process of persistence and faith and positivity, and we all get down. We had a 9-week loss today. It was really devastating. We were able to do the DNC quickly, some frozen embryos. We want to change it up. We want to look towards new and different. But at the same time, sometimes it's just putting in another embryo and having faith in the process. What are the odds at 46 to have chromosomally normal eggs after strict keto for 6 months? It's a lower probability, but it's not in the no probability. And I always say doing nothing is the zero outcome. So doing something always going to boost your odds. And those that never do never really get in the process. So I don't know the real odds, but it's not zero and it's not 100% for anyone in this process. And partly I always kind of talk about the universe as the great creator of everything in our lives. And some people call that God, spirit, nature. And somehow this great creative influence, this energy that's created all of us on this journey knows what it's doing. And so it's responsible for the outcomes as they are 100% of the time. So in some way, what's the outcome? It's going to be perfect always, but it's our ability to change what we think about it. Imagine that, you know what? I learned something from this. I'm going to change it up and be persistent, and I'm going to believe and imagine that we are bringing in all the great things to help make this happen. And the CNY Fertility team, along with so many other fertility centers and practitioners out there that have shared great ideas, both traditional and non-traditional, in every way. Let's see. Joyce, South Carolina, everyone out there from the South, really a pleasure. And do you recommend low mini IVF for women over 40? Well, if the standard approach, which is about 300 units of gonadotropins a day, isn't working, and you're not making many eggs with the higher dose, then going down to a mini, which is a combination of letrozole and 150 to 300 of gonadotropins, but really letrozole 2.5 to 5 milligrams for 5 to 10 days, plus 150 of gonadotropins, either the form of Gonalef, Menopur, or Follistim, may get you the same outcomes. And even in some cases, I've gone right to a natural. I've gotten 4 eggs, 4 embryos, 2 transferred, 1 baby, and 2 on ice. So how it's going to work, I always say you just got to keep on mixing it up and changing it up and be persistent and keep going. And Melissa, how are you guys doing? Zayan, can you discuss the donor embryo option at CNY Fertility? One is, please encourage everyone out there, donate those extra embryos to help create life. Gives us the opportunity to share those embryos at a lower cost and a lower transfer fee than I think anyone else out there. Basically, if you have a friend, a relative that has some extra embryos and they donate them directly to you, fantastic. If not, we are getting direct transfers to our location, and in many cases, people are getting embryos donated from other fertility centers, which they then will transfer to us in Syracuse or Albany and make it a much more pleasant, global, and integrative approach, Eastern, Western, and affordability. That's really the key. So, basically, a consultation with one of our practitioners, talking to our embryo donation, egg, sperm donation consultants. Our donor team can really help on that and get you moving forward. Egg quality. All right. It starts with this, faith and relaxation. All right, meditation and prayer. It then goes right to this. What do you put in this thing? Keto, paleo. And remember, there are some vegetarian plans out there that you can use. So don't give up on this if you have a specific dietary needs, even though I'm mostly a carnivore. But I know there are lots of approaches to this, and we got to be open to them, all right? Even vegans, by separating out your food, it'll really help and improve the egg quality. DHEA, CoQ10, fish oil, folic acid, low-dose naltrexone. And look at mind massage, acupuncture, and take a walk in nature. Light exercise. I typically recommend get rid of the exercise, but lighten it up and slow it down. Reduce your cortisol, reduce your epinephrine, sit by a fire, cozy with your partner, good friend, and relax and enjoy. Get rid of the news, read something positive, listen to something positive and uplifting. And if you haven't listened to The Alchemist by Paulo Coelho, you gotta do it. It's amazing. I just reread it again. And remember, most of these recommendations are for men and women. Stay out of hot tubs, get rid of alcohol, certainly no drugs or tobacco. And look at Theralogics for Ovasitol, Ovavite, Conception XR, and the DHEA. Anellis, I hope I pronounced that right, and I really apologize if I'm not pronouncing names right. I'm working on it. Ectopic pregnancy and IVF. So when you actually take a catheter and place the catheter in the uterus and then slowly place the embryo or embryos into the uterine cavity, sometimes they actually can travel out to the fallopian tube. Quite often they likely come back because that's the natural flow, but about 4% of the time it stays in the fallopian tube. And that's called an ectopic pregnancy when it grows in the tube or in the ovary, but any place outside the uterus. And it does happen, and even when everything appears normal, in some cases, because of hydrosalpinx, we'll recommend clipping or removing the fallopian tubes. But if it happens once, it's not likely to happen a second time from IVF, but it can happen. So got to be open to that. All right, let's see here. Let's go back to, all right, well, let's see here. Where are questions? Since we're still here, you got to get me back into our questions. Will's always there to help me out. Yeah, I lost it on this one. I'll just take this iPad. Great. And all right, always technical difficulties, but boy, isn't it pretty amazing? From around the globe, we're able to communicate. We also use WhatsApp for videos, but Facebook has really been quite amazing. And again, I'm really grateful. 2 more minutes, and I got to get a little rest tonight because we've got a really busy day tomorrow. And Sarah A., thank you for the shout out. Again, we're sharing affordability, quality, and access. Don't forget to share with your employers and your representatives in your local, state, and national government how important family building is, and that IVF and fertility coverage should be across all genders, ages, and methods. So again, we're here. There's the Resolve evening tonight down in New York. Another celebration. A shout out to Resolve. Grateful to everyone at Resolve for all the great work they're doing to share the challenges, help bring affordability, quality, and access to everyone. And so again, sorry I couldn't make it. And a shout out to our EIVF friends, Practice Highway, for also helping us connect in a much better way. Sarah, good question. PQQ. I haven't brought PQQ up in a while, but PQQ is another mitochondrial cofactor similar to the ubiquinol. So I highly recommend it. I think it's about 20 milligrams a day through Amazon. You can get it. So Kathy, at what age is too old to have a baby? I don't know that answer. There are some 20-year-olds that are too old and some 60-year-olds that are young as can be. I don't know. If guys are having babies into the 60s, is it sexist that women should be thought not to be able to? I think it's really, really individualized and really need to talk to your physician. Really great news about the uterine transplant in the United States, delivery. I think it's going to be really another level, another option for so many women, either born without a uterus or lose it from surgery, or really have uterine factor, poor quality uterus, poor lining, fibroids or adenomyosis, where surgical treatment and repair isn't helping. That may be the next step on the next level. And I talked a little bit about to Kristen earlier about maybe even ovarian tissue transplantation, and think about freezing eggs and ovarian tissue at a younger age, a little bit of his insurance policy for future use. And all right, last question. Thanks, Autumn. OBGYN told me I had PCOS, but I have my period pretty much every month. Well, metabolic syndrome, PCOS, and there's a huge variety of all of this. I personally believe all of us have some form of PCOS or metabolic syndrome. It's some form of hyperglycemia, which causes glycation, causes damage to every molecule, every cell of our body. It's a hard one for younger women because when you do a vaginal ultrasound or a abdominal ultrasound, many of them have polycystic ovaries. Very common, doesn't mean you have polycystic ovarian syndrome. I think keto, Ovasitol, LDN, really helpful either way. It's not a bad diagnosis. It's really, to me, it's a pre-diabetic diagnosis, pre-hypertension for so many of us, men and women. And so maybe just take it as a little bit of a, hey, maybe I need to look at this, change my diet, maybe slow it down, look at some of these supplements. Ovasitol over metformin, I think it's better tolerated. And so again, this Sunday, Eastern time at 4 p.m. And I'm going on vacation next Tuesday evening, afternoon to Sunday evening. Little downtime. So that's, I think, the 12th through the 17th. I'll be coming back. But I'm always sharing, always learning, always looking around. Think how to take care of this is a complete package. What you put in here, what you put in here vibrates of what is here. And when someone says it can't be salvaged, look around. My bet is there's always a way. And I've seen it happen time and time and time again. This is Dr. Rob Kiltz, just talking for the CNY Fertility team. Will, thank you very much. God bless. And don't forget, share the video, share the likes, tell us where you're coming from, and God bless. Dr. Rob Kiltz. Enjoy.